New at 5 hospitals are facing dire staff shortages and offering higher wages and new incentives for employees to stick around. Newswatch reporter Jacob Comer tells us how local hospitals are faring in the staffing crisis.
Hospitals across the country are facing critical staffing shortages, and the same is true here in the Mountain State. The need arises due to the overwhelming number of COVID-19 cases and hospitalizations. And according to a report by Quote Wizard, roughly 4 out of 5 ICU beds in West Virginia are currently in use, and 44% of hospitals in the state say they are critically understaffed.
When you look at it, you are seeing staff being burned out and overworked, and you are also seeing just a large number of people coming in. So it really is burning the candle at both ends.
The need for extra help is so bad in some areas that Governor Justice has sent the National Guard to lend a hand. Some local hospitals here in southern West Virginia are affected as well. Beckley ARH is one of the hospitals to receive some help from the National Guard, and also has a job fair lined up for next week in an attempt to find more medical staff. And they're not the only hospital with staffing issues. Raleigh General Hospital says they are understaffed as well, and in an attempt to find more staff, they are offering to hire new nurses at a rate of $95 an hour.
Basically, what we've been focusing on is recruiting local talent. So that's why you've seen the $95 rate. That's why we have incentive bonuses and retention bonuses for the staff that have stayed. It's a challenge. Especially this past year, I think it's really spotlighted how hard nurses actually work and what goes into the care of a patient.
The hospital staff shortage is not expected to end anytime soon, and West Virginia isn't even one of the hardest states hit in the hiring crisis. In the Northeast, Rhode Island, Vermont, and New Hampshire have some of the highest number of hospitals with staff shortages. Reporting in Beckley, Jacob Comer, Newswatch.